A good candidate for hairline lowering in many cases is number one, female. And the reason for that is because female patients tend to not have a history of hair loss at the hairline. That comes into play because hairline lowering requires an incision at the hairline, which will heal with a very thin incision line, but inevitably will create an incision line. If someone is losing hair, for example, male pattern balding, not a good candidate for hairline lowering because there is high potential for more hair loss and exposure of that incision line at the hairline. So that's number one. No history of hair loss makes you an ideal candidate for a hairline lowering. Number two, hairline lowering candidates are typically patients who have a long-standing history of congenitally or born with it, high hairline, large forehead, meaning that the balance of the thirds of their face are out of proportion. Measuring the thirds of the face, and what that is to me is the lower portion of the face is the first thirds, from the bottom of the chin to the bottom of the nose, from the bottom of the nose to the middle of the eyebrows, and then from the middle of the eyebrows to the hairline. Those are the thirds of the face. And when those are in very close balance with each other, then the entirety of the face is seen to be in more proportion. Candidacy for a hairline lowering relies on the amount of laxity of the scalp. And what that means is how loose the scalp is over the bone structure. So ideal candidates for hairline lowering have a really good amount of laxity that I can rely on to be able to move that scalp forward the distance that I need to get them more balanced.